Good morning and welcome back. Today we have Dr. Syed Rizvi joining us from Piedmont. Today we're talking about Men's Mental Health Awareness Month. Thank you for being here today.
Thank you for having me, Monica.
I'm excited because this is a really important topic, talking about men's mental health awareness. Why is it so important that we talk about men's mental health?
The important thing, of course, is men generally don't like to go to the doctor. They don't like to discuss their health issues, let alone mental health issues. So it's very important that we focus on men's health and in particular mental health, and bring it to light and bring it to, and create awareness to these issues, because men have that macho complex.
Everything's okay, right?
Everything is okay and nothing can be wrong with them. So they tend not to go to the doctors, and there was a study which showed that at least 55% of men don't get screening health care, or don't like to go to doctors, and so a lot of these issues don't come to light.
That's a huge percentage, 55%. Wow. Now I want to talk about it. Should men go and see a doctor even if they have no chronic health issues? I mean, should they be going to their doctors regularly?
So if somebody does not have a health issue, it's even more the reason they should go to the doctor. And the reason is not everything that is a medical or mental health issue will show up as a sign or a symptom. So they may feel fine, but unless they go and get checked by the doctors regularly or screened by the doctor regularly, some of these things may never come to light. So for example, if somebody feels, oh, I'm fine, I'm not having any symptoms, they go to the doctor for some reason and they're found to have high blood pressure, or they have their blood test done and they are found to have their cholesterol to be high, those things would not have caused symptoms unless they had gone to the doctor and had those things checked out.
So it really is important they're going.
Definitely.
Wow. I think it is important. Please go to your doctors. Now, what are specific health screenings that men have to get? Do you have any specific ones?
So the most common one that everyone talks about is, of course, prostate screening, but colorectal screening is very important. In younger men, testicular cancer screening is important. And in smokers, lung cancer screening is advised after age 50, especially if they have been smokers.
Are there any tests that they need to go before the age of 50 to get tested on?
So the tests that they should get done routinely or regularly, a simple blood test can tell them if they have prediabetes or if their sugars have been high. So even before they become diabetic, you can find if they have prediabetes and treat it to prevent them from getting diabetes. Then blood tests can tell you about your cholesterol. So if somebody has no symptoms, of course, if their cholesterol is high and you treat it, you can prevent heart problems, especially if they have been screened early on. So similarly, blood pressure checks. Patients may have no symptoms from having high blood pressure, but once they get checked and if they have high blood pressure and they get treated, you can prevent issues with the kidneys and the heart just by controlling their pressures.
Wow, that is incredible. Now, you heard it here from Dr. Rizvi. Even if you think you're okay, please go to your doctor, get your screenings, get checked. And of course, it is normal. Let's talk about mental health and make it more normal. To find out more about this, go to our website, 41NBC.com.